Welcome to the Palm Beach Civic Association's Committees at Work. In this series of reports, we present a three-part program on dementia and Alzheimer's disease, brought to you by the Civic Association's Healthcare Committee. Join us as we delve into the complexities of these conditions, exploring the latest research, innovative treatments, and compassionate care strategies. Hello, I'm Claudia Shea. In this second report in our Dementia Education series, we're building on information we shared in Part 1, Understanding Dementia, which really served as a broad overview and is available for your viewing on our website, palmbeachcivic.org. Now, in Part 2, Dementia Recognition and Resources, you'll learn about groundbreaking treatments and expanding resources for those affected. Among the promising breakthroughs is the introduction of a novel medication called Leqembi. Neurologist Dr. Dennis Selkoe, co-director of the Ann Romney Center for Neurologic Diseases at Brigham and Women's Hospital in Boston and a part-time Palm Beach resident, has devoted 4 decades to applying advanced biological methods to achieve a deeper understanding of the causes and basic mechanisms of Alzheimer's disease. Dr. Selkoe, thank you so much for joining us today.
Delighted to be with you.
We would like to begin by having you take a moment to talk to us about the Selkoe Laboratory and the work that you're doing there.
So the Selkoe Laboratory is at a wonderful hospital in Boston called Brigham and Women's Hospital, which is a Harvard teaching hospital. I'm a professor of neurology at Harvard Medical School and at the Brigham and Women's, and we do amazing experiments on cells, on mice, to understand what the origins of dementia are and how dementia works. And we've done a lot of work over a long time, about 4 decades now, that has led to some breakthroughs for Alzheimer's.
And at what stage is Alzheimer's typically diagnosed?
So Alzheimer's is a dementia. The word dementia means loss of mental ability as you get older. And there are many dementias. Alzheimer's is the most common one. It accounts for about 2/3 of all dementia in the United States, and it's seen around the globe. We think there might be 300 to 350 million people in the world who have dementia, maybe more than that. Alzheimer's is the most common one, 2/3 of all cases of dementia, and it has certain characteristics. It's something called amyloid plaques and neurofibrillary tangles in the brain.
Let's take a moment to take a closer look at this degenerative process in a video prepared by the National Institute on Aging.
Neurons constantly communicate with each other through electrical charges that travel down axons, causing the release of chemicals across tiny gaps to neighboring neurons. Other cells in the brain, such as astrocytes and microglia, clear away debris and help keep neurons healthy. In a person with Alzheimer's disease, the most basic form of dementia, toxic changes in the brain destroy this healthy balance. These changes may occur years, even decades, before the first signs of dementia. Researchers believe that this process involves 2 proteins, called beta amyloid and tau, which somehow become toxic to the brain. It appears that abnormal tau accumulates, eventually forming tangles inside neurons. And beta amyloid clumps into plaques, which slowly build up between neurons. As the level of amyloid reaches a tipping point, there is a rapid spread of tau throughout the brain. But tau and beta amyloid may not be the only factors involved in Alzheimer's. Other changes that affect the brain may also play a role over time. The vascular system may fail to deliver sufficient blood and nutrients to the brain. The brain may lack the glucose needed to power its activity. Chronic inflammation sets in as microglial cells fail to clear away debris, and astrocytes react to distressed microglia. Eventually, neurons lose their ability to communicate.
An amyloid plaque is a collection of proteins that's deposited in tiny microscopic bundles in many, many places in the brain. So they can't be seen with the naked eye. They're very tiny. And these amyloid plaques contain a protein called amyloid beta protein, or A-beta, and it builds up over time in many of us as we get older. There's very few of us who, after the age of 60 or so, don't have a few of these amyloid plaques. A few people can't handle that process well. It happens almost universally, but some of us don't handle it well. Not handling it well means we get an inflammation around that deposit called an amyloid plaque, and we get damaged nerve cells, neurons, with abnormal nerve processes. So we know a lot about it. Alzheimer himself described it in 1906, a long time ago. We use some of his same methods to see them in the tissue of people who die with Alzheimer's. But now we can image them in life, non-invasively, with something called an amyloid PET scan.
Before you get to the point where you are being diagnosed, you must be displaying some kind of symptoms. So what would be some of the earliest symptoms that people should be aware of?
Little lapses of memory, where you repeat yourself, where you ask the same question multiple times. All of us do that a little tiny bit, but generally we catch ourselves and we know if we're saying the same thing that we said 5 minutes ago, someone will say, "Didn't you say this?" "Oh yeah, I did say it, I'm sorry." And that kind of self-recognition and self-awareness is lost in people who go on to develop Alzheimer's. They're not aware that they're making little lapses. So the cardinal symptom is small lapses of memory, often about unimportant things. They still remember their children and their grandchildren and things of that sort, but they don't remember exactly where they parked their car this morning, and they can't retrieve a certain events that happen in their life. If you ask them, "Well, what about your trip to Florida?" They'll not be able to give you details about that. What we've learned is that your family history of something like Alzheimer's or another dementia can be very telling and can make it more likely that you will get this. And we can do genetic tests to do that. Once we know that there's some trouble afoot, we will do an orderly workup, which means we might get an MRI scan of the brain to make sure there's no tumor or vascular abnormality, stroke, because those are not the causes of Alzheimer's. And we rule all that out. And then if we're really suspicious, we get this remarkable breakthrough test that's now more and more available called an amyloid PET scan. That test will show whether you have amyloid plaques in the brain. So it's very telling. It's not possible surgically to clean out the plaques. They're microscopic. There are literally millions of them in thinking parts of the brain by the time you develop real forgetfulness and Alzheimer's. So we have to use treatments other than surgery. And what we use is a remarkable antibody treatment. So now I'm talking about a breakthrough that was approved by the FDA on July 6, 2023. And that was a red letter day for a nerd like myself who've been studying this disease for all these years. And that treatment was getting an infusion in a vein in your arm once every 2 weeks of an antibody. It has a name. It's called lecanemab is the generic name, and the brand name is Leqembi.
How long are they on this treatment? Is it the rest of their lives?
Not necessarily. We're working that out because the treatment was only approved in July 2023. So we're just starting to treat at my clinic and others. A lot of people, they're lining up now because there's never been a treatment before. We now treat them for 18 months or 2 years initially, and we follow how they're doing. And we even have blood biomarkers, taking blood tests and measuring, is the Leqembi treatment calming down the Alzheimer's disease. There are competing antibodies. There's one called donanemab from the Eli Lilly company that's likely to be approved by the FDA in a couple of months from now, and that will be a competing antibody. And we doctors will have to decide, should you get Leqembi, the first one, approved, or should you get donanemab?
Now, I understand that there's also research with a nasal spray?
Yes. So that's something that's unique to our center. Our center is called the Ann Romney Center for Neurologic Diseases, and indeed the renowned Ann Romney and my partner Howard Weiner, who's an MS expert, also an Alzheimer's expert. Howard invented a nasal spray that you just sniff a little bit, and it activates T cells, which are immune cells in the nasal mucosa and the lining of the nose, and they go to the brain ultimately, and they shut down the inflammation and they clear the amyloid plaque. So it's quite remarkable. But I think the nasal vaccine is an alternative to what I've referred to as Leqembi, which is a monoclonal antibody. But it's going to be some years until we know if this sniffing a little nasal vaccine will do the job that the antibody is doing intravenously.
How do you know when a patient with dementia or Alzheimer's is at that point where you really can't take care of them at home anymore? And then what support is there for the caregivers, when it just gets to be so much on their shoulders?
Right. When the Alzheimer's patients advanced from the mild to the moderate stage of the disease, other bad symptoms begin to appear. They don't walk as well. They may be prone to falling. Many patients develop incontinence of the bladder. They can't control that anymore. And frankly, it's because they lose memory for how to do things the right way and to take care of themselves. So when that arrives with moderate Alzheimer's or more into the severe form, many families don't feel comfortable trying to take care of this at home. And that's the time to find a care facility. That's a hard job to do. The Alzheimer's Association, nationwide, worldwide, has a lot of information online about both how to find doctors that can help you with Alzheimer's and how to find facilities where your loved one could live. There are also social workers, psychologists, who often will counsel the members of the family more than the patient. The patient is losing memory and cognitive function and can't be counseled that much. I won't understand that, but a daughter or a son or a spouse can be counseled, and there are wonderful resources available.
If anyone is watching this show and they've recently been diagnosed with Alzheimer's or a family member has, what do you want them to remember?
Like any other bad problem in medicine, you've got to look in the eye and recognize it. And, it used to be a lot of people were very awkward in talking about something like dementia. They felt that they were somehow responsible for it, that they weren't smart anymore. But that's not the case. These are mind-robbing diseases that are due to specific abnormalities in the brain that we now know. Amyloid plaques, neurofibrillary tangles, Lewy bodies. So you need to get to a specialist who knows this stuff well and who can guide you to what treatment you want. And we want to get many more patients treated than are being treated now.
So the diagnosis isn't the end, it's the beginning of your next journey.
It is, and you got to fight against it. And my optimism, which I feel strongly, comes from we've made enormous progress. When I started in this work and saw my first few Alzheimer's patients, it was absolutely devastating. And I saw what the family, and people hadn't even recognized the word Alzheimer's. They didn't know what that was. Now it's universally known. That's happened during my relatively brief career. And we now can do something about it.
Dr. Selkoe, I really appreciate you taking time from your busy schedule and sharing all this valuable information with our audience.
Thank you for your great questions, right on the mark, and I'm delighted to have been here.
As Dr. Selkoe and other physicians strive to confront the challenges posed by dementia and Alzheimer's disease, much research is also underway aimed at preventing cognitive decline. From diet and exercise to brain-boosting activities, many lifestyle choices can make a significant impact on brain health. Discover the simple steps that you can take today to safeguard your future. In part 3 of our series, be sure to visit our website, palmbeachcivic.org, where this series is being released as it's posted. We'll see you next time.